Welcome to the Women's Guild Simulation Center at Cedars-Sinai. The purpose of this center is to mimic intense clinical situations and adverse events, which could take place within any hospital. But before we get started, there are a few simple but important rules that we ask everyone to follow in order to create a safe environment. Not following these rules impacts your colleagues and their experience. The first rule is that you must wear your badge at all times so that it's visible. Thanks, Amelia. Now, let's get started. The classrooms are where you will be debriefed after each simulation. Debriefing is vital to learning, as it's been found that 80% of mistakes are associated with basic human error, not technical skills. Instructors will observe your communication, teamwork, and leadership. The goal of our simulations is to identify areas of improvement so that you'll feel more prepared to respond if a situation does arise. Let's take a moment to review the rules. Rule 1. Cell phones. Absolutely no cell phone should be used during simulations or debriefings. This includes calls, texts, emails, and social media. If you need to use your phone for any reason, please do it during the allotted break period in the lounge or outside the facility. If that's not possible, then you'll be asked to reschedule your course. Rule 2. Food or drinks. No food or drink is allowed in the clinical areas, and this includes the skills rooms. Food and drink is allowed in the debriefing areas and the Barbara Herman Lounge. We ask that you tidy up your area before you leave. Rule 3. This is a safe zone. We ask that you do not discuss any actions or events that have occurred in the simulation center. We want this to be a safe environment where skills can be expanded for everyone, and to achieve that, we must trust one another. Rule 4. Badge. I've already mentioned this before, but make sure you wear your badge at all times and scan it under the barcode reader when you leave the center for the day. Rule 5. Practice makes perfect. Your participation has a direct impact on the patient care that you and your colleagues provide. Please keep in mind that we're here to make mistakes in a safe environment so that we can avoid them with our patients. Please be aware that all simulation events are recorded and are confidential. They may be used during your debriefing, but all videos will be deleted after training, unless your simulation is part of an approved research study. Now for the tour. The center is split between two areas: the learning environment, which consists of the debriefing rooms and the lounge, and the clinical environment, which starts here at the white flooring. Our clinical environment has 2 ORs, an ICU, obstetrics, trauma, PICU or NICU, patient rooms, and a virtual surgical training room. Again, you're reminded that food and drinks are not allowed in these areas. While we're here to practice emergencies, we must remember that real-life emergencies happen all the time. In the event of a real emergency, there are a few things that you are responsible for doing. You are an active participant here, not an idle bystander. A crash cart is located between the lounge area and the virtual reality simulator room down the last hallway. In the event of a cardiac arrest, go to the nearest phone and press the code blue button, or dial 121. Tell them that you are located in the Women's Guild Simulation Center at A1300. We are located at the street level of the Advanced Health Science Pavilion, also called AHSP. Once you've notified the hospital operator, assign one person outside the center to escort first responders to the patient. Also notify a member of our staff in the event of a clinical emergency, so they can provide assistance while help is on the way. And lastly, should there be any need to evacuate the center, you'll be notified over loudspeaker or by a staff member. Please listen to the full instructions. Exits are located at the front and back of the facility. Thank you for using the Women's Guild Simulation Center. Should you have any further questions, please contact your instructor or a staff member, and we'll be glad to help.